I don't know what to do. I feel like I'm gonna throw up. I took that whole 14-day course of omeprazole, but I still feel like I get heartburn a lot. What do I do? Since you don't want to take a PPI for too long, I suggest that you switch to an H2 receptor blocker like famotidine. This can also be taken under a course of up to 8 weeks, and this will help with your heartburn long term. Have you ever heard about famotidine?
Marissa, what are you listening to?
Oh, I'm listening to Pepcid by gastric acid. So have you guys ever heard of the drug famotidine, also known as Pepcid?
Yeah, so the general use is gastroesophageal reflux disease, GI ulcers, heartburn, sour stomach, and stomach acid.
Oh, what are you eating? I'm eating chili chews. What are you eating?
I'm eating baked hot Cheetos.
These are kind of hurting my stomach though.
Mine too. And I know a little bit about the mechanism of action. It inhibits histamines that are on the H2 receptor sites that are on the parietal cells and act to decrease gastric acid secretions.
Oh, you know what? I have heard of that. It comes in, I think it's a dose, normally 20 milligrams a day, and people can take it 10 minutes to 60 minutes before they eat a food that's known to give them heartburn.
And some side effects that I heard, as well as some adverse effects, are headache and dizziness, as well as some really intense nausea, vomiting, and diarrhea, as well as constipation and irritability, and agitation if taken under the age of 1. And more serious side effects are hypersensitivities like Stevens-Johnson syndrome.
Oh, this rash is killing me. It hurts. It came out of nowhere.
Is that Stevens-Johnson syndrome?
Seizures, and even toxic epidermal necrolysis. Yeah, that's pretty intense.
And then for the patient education, you would instruct the patient to use the proper over-the-counter product, advise the patient to limit the use of prescription drug to no longer than 8 weeks, and use of over-the-counter no longer than 2 weeks. Advise the patient to report any abdominal pain, blood in stool, blood in vomit, or coffee ground emesis.
So some key nursing considerations that I've heard of is to assess the patient for any abdominal pain, look for blood in any emesis, stool, or gastric aspirate, and monitor with renal dysfunction for QT interval prolongation. Yeah, so that's something we can use later on in pharmacology class.
We should definitely keep stomach acid and reports of heartburn in mind when we're treating our patients.
Makes sense.
As well as for ourselves during our exams.
Hey, I think that heartburn medicine I took is working.
How do you know it's working?
I feel a lot better. I don't have that fiery feeling in my chest. I stopped coughing, and I'm able to eat all my favorite foods again.
I'm gonna have to try that next time.
Huh.
Is that Stevens-Johnson syndrome?